I use amino acids as my first line of defense so people get a very fast win, John, because when you can calm the brain, so if I can open up a capsule of tryptophan, for example, put it underneath the tongue and the anxiety that they walked in with dissipates, then that's a win right then and there. And it's immediate. Like many things in our world can you do that you get such an immediate reaction? And you can with the amino acids.
Hi, and welcome to The Balancing Point. I'm Dr. John Nieters, and I'm here to make traditional Chinese medicine, functional medicine, and integrative health simple, practical, and fun so you can restore balance, boost vitality, and enjoy a healthier life every single day. Hi, this is Dr. John back again with another edition of The Balancing Point. I hope you stay till the end today because we've got someone I'm very, very interested in talking to. I have recently been kind of taking a deeper dive going back into looking at amino acid therapies in conjunction with Chinese herbal medicine and to see how the different diagnostics fit together. And I'm really excited about it. And then Laurie showed up. So I'm really excited because she's a functional nutritional therapist. She's the founder of the Take Back My Brain method. I love that one.
Thank you.
She focuses on helping clients with depression, anxiety, eating disorders, and other neurological conditions. And her personal journey of overcoming personal health challenges through holistic methods drives her passion. She's dealt with cancer, celiac disease, bulimia, and depression. And now she's taken that personal knowledge and shared it with her clients in terms of what she did to overcome those problems. And um, sh- one of the things she likes to do is offer hope and practical insights for moms dealing with anxiety, depression, and the overwhelming demands of life. And that's really fabulous because we have a lot of those overwhelmed moms coming in here. So,
I'm
Lori,
sure you do.
yeah. So today we're going to talk a little bit about amino acid therapy, right? Taking back your
Yes.
brain.
Yes.
Fascinating topic. So, we see so many people that do the wrong things, but we see a fair number of people who seem to do all the right things. They eat correctly, at least in their mind. They sleep well. They don't abuse drugs or alcohol, and still they're suffering from extreme anxiety. Do you have any insights into that?
Yeah, I see it all the time. I've experienced it myself. There's usually some deficiencies. I like to go back to the amino acid deficiencies because those are foundational to building everything in our body. So if there is still an underlying deficiency going on, people are still going to be anxious and depressed. And then they're going to get misdiagnosed with things that they don't actually have.
And then get drugs that don't actually treat what they have very well.
Yes, we could go on that tangent as well. I could talk a long time.
Right. Well, I look at the percentage effectiveness of SSRIs, and it becomes pretty clear when we look at how your diagnostics work or look is that it's not going to work for the majority of people. So,
Correct.
yeah. So let's start with the basics. What are amino acids and why are they so critical for the brain and our mood health?
Well, amino acids are the building blocks to peptides, proteins, everything in our body most people think of them as muscle building, your hair, skin, and nails, but really it's your hormones, your neurotransmitters, your digestive enzymes. All those things are dependent upon having enough amino acids in our body so that your body can repair and rebuild.
Awesome. And so how do you identify the different types of conditions so that you know which specific amino acids to give to your patients?
So I'm looking at brain-based, amino acids, which ones are going to affect those neurotransmitters. And so I'm looking at 5 different categories and symptoms in those 5 different categories to assess, is there this dysfunction? Is there a deficiency going on? So it's serotonin and GABA and your endorphins, your catecholamines, and then glucose regulation. All of those categories have amino acids that can help.
Hmm. Awesome. Well, let's start with the serotonin type deficiencies, right? And we talked about that a little bit.
Absolutely. That's one of my favorite topics because SSRIs are such a hot topic right now, which I'm glad they're a hot topic because I think they're very detrimental to our society as a whole, and amino acid therapy can provide a beautiful alternative to using mood medication in that manner without side effects.
Hmm. Awesome. And so with low serotonin, what types of conditions would you tend to see so that you would know how to identify?
Yeah, so I would see anxiety, depression, OCD, panic attacks, your mind rabbit trailing quite a bit, so kind of that hyperactivity, being irritable, PMS, snapping at people, and you're like, "Why am I snapping at people? This is not my personality." Having issues falling asleep, trouble staying asleep, afternoon, evening cravings, a lot of those things are serotonin deficiencies.
Awesome. We title our initial intake appointment Getting to the Roots. And I'm seeing other people are starting to do that also. And that seems to me what you're doing. You know, you're not treating the symptoms only, although the symptoms will go away, because medications aren't fixing the root cause of anxiety and depression. And any more than blood pressure medications are treating the causes of blood pressure. It's because as soon as you stop using them, you have high blood pressure again, right? So it's really just treating the symptoms. And it sounds like what you do goes right to the roots of the problem.
Exactly. We want to fix the deficiency and then figure out why did you have the deficiency in the first place.
I had been fascinated by a book that I've had for a while called Nutrient Power. And he,
Mm.
in that Walsh, was coming at it from a vitamin mineral deficiency, but he doesn't say much about amino acids. So it seems like a great way to couple things together.
Absolutely. I mean, we need the amino acids, we need the minerals, we need all of those foundational pieces. But I would say, as you were saying before, amino acids are kind of the forgotten foundation.
Yeah. Pretty much forgotten by me. 25 years ago, I was using them a lot more than I've used them over the last few years. So,
Hmm.
yeah, certainly forgotten, and certainly forgotten by most of the medical community.
Yeah.
Who and it's hard, it's hard if you have 10, 15 minutes to handle everything
Oh yeah.
and get to the root, right?
And
So,
it's not super sexy, right? I mean, amino
yeah,
acids aren't that exciting. Biohacking is. Um, so whether
yeah,
you're talking, mainstream medical or even functional wellness, foundations is missed a lot just because it's not all that fun and it takes
yeah,
a while to fix those deficiencies.
yeah. Although I've seen some people add some amino acids and get some pretty quick results.
Very fast results. Yes.
Yeah. And so I noticed that your focus is on calming the brain first, right?
Mhm.
What does that literally mean in practice?
Literally, that means I use amino acids as my first line of defense so people get a very fast win, John, because when you can calm the brain, so if I can open up a capsule of tryptophan, for example, put it underneath the tongue and the anxiety that they walked in with dissipates, then that's a win right then and there. And it's immediate. Like how many things in our world can you do that you get such an immediate reaction? And you can with the amino acids. And so when we calm that brain first, it's so fast, then they can process everything else that needs to be dealt with. And we see what's left over. What mood issues are still left over, if any? What digestive issues can we deal with? So when the brain is calm, then your digestion's easier to heal with, your hormones are easier to heal.
That's a great answer. But you said something that I found very fascinating. Do you use your amino acids sublingually very often under the tongue?
I use them sublingually all the time for testing to see
Uh-huh.
which ones people are going to respond to. And then people can take them orally, swallow the pills, when they take them on a consistent basis. Or if they're having like a panic attack or an intense food craving or an alcohol craving or something of that nature, they can open up those capsules and get immediate relief and not wait for that 20 minutes to go through your digestive system.
Wow, that's awesome. As you're speaking, I have a pull down menu coming down of all my patients that I need to contact. Yeah, I did
Definitely.
a telehealth with a patient yesterday, and this would have been useful information. So,
Well, but just follow up with them.
gotcha, gotcha. And so it sounds like you're saying that anxiety and overwhelm, um, are really mostly biochemical, and that they could, if that's the case, which I assume it is, that they could rectify that fairly quickly.
Definitely very quickly. And about 90% of the people, things rectify very fast.
In some medical offices treating certain conditions, they will tell people that they may get worse before they get better, right? And to kind of, you know, to keep in contact, tell me the symptoms, but don't be alarmed by it. Do you ever find that with amino acid therapies?
Uh, I mean, every now and then there might be an outlier, but
Yeah.
like I said, 90% of the time, no, there's
Okay.
not issues. You're gonna get
Well,
immediate
that's
relief.
awesome.
Yeah.
That's great. So going back to serotonin, are you willing to share what kind, and this is not for people listening to do it themselves, because you really should have someone that's highly trained, because the last thing anyone should do in most cases is self-diagnose. And I can tell
Correct.
you half a dozen stories about me self-diagnosing and
Me
getting
too.
it wrong. And if it'd been one of my patients, I would have gotten it right away, right? But I'm a
Yes.
little too close to my own problems. And so any suggestions or answers that Lori gets, please don't run out and just start experimenting with your amino acids. Do you do telehealth, Lori?
I do telehealth. About
Yeah.
80% of my practice is telehealth.
Yeah. So if you have questions about where to start, just give Lori a call and, get an expert on your side. And again, once you figure it out, it may not take a lot of additional appointments. I don't know. But once you figure it out, it should be a little bit easier to get clear sailing. So going back to serotonin, any general things that you would tend to look at as amino acid treatments?
You mean what supplements I use? Is
Yeah,
that what you're
yeah.
asking? Yeah. So I would tend to use 5-HTP or L-tryptophan. I like to start with L-tryptophan first because it converts into different things, not just serotonin, where 5-HTP only converts into serotonin. So I love to go to the fact where let the body do what the body needs to do with what you give it. And so that's why I like serotonin or tryptophan first.
Mhm.
But if somebody doesn't respond to tryptophan, we will use 5-HTP.
Yeah, I remember decades ago, and I don't know how many decades because I'm old enough that I don't remember all my past so well.
Yeah.
But when tryptophan got a really bad name,
It
yeah, and that was probably 25, 30 years ago.
Oh, yeah, because that was in the late '80s when
Yeah,
that happened, 1989.
yeah. And
Yeah.
hey, we're
Very
warning
bad
people not.
rap, and it wasn't tryptophan's fault.
Yeah, well, you see that so often, you know?
Mhm.
It's like when you look at HRT and there were increase in cancer risk and they blame it on the estrogen. Well, that
Right.
wasn't accurate. It was, yeah, it was the progestins. Okay, that's a great start. And so what about my first question when I have a patient come in and they say, I'm depressed. And I would say, first, I try to divide it into two bigger categories. Do you have a lot of negative self-talk, or do you just don't have enough energy to get off the couch? You just don't care anymore. And they'll identify usually one or the other, sometimes both. And so for the blahs, the I can't get off the couch, I don't have any interest in life anymore, apathetic. How would you look at that?
I would look at it as more of a catecholamine deficiency, and so then I would assess that with, like, a DLPA, D-L-phenylalanine or L-phenylalanine or some tyrosine, and
Mhm.
then, if somebody is a lot of negative self-talk, we're gonna go back to serotonin for sure.
Right. Okay. And what about protein intake? Do you find that to be a significant issue?
A significant issue. Most people are under eating protein, especially animal protein. And I've had clients go home and eat hamburger or steak, and they'll send me a message like, my brain is tingling after I ate
Yeah.
protein. Yes,
Yeah,
because it was
exactly.
starving.
Yeah, that's a good point. And so then what about the people well, I'll have a specific for you. I've run into the too sensitive and sometimes called. Usually we'll see this historically in females around menopause most often. It could affect other people. But lately, one of the people that works for me has 4 or 5 nieces that just if you say the word no, they go off. I mean, they're totally uncontrollable. And I had not seen that in at least in kids and as much until pretty recently.
Mm.
What would you call that type?
I would definitely go back to serotonin and I would go to GABA.
GABA, okay.
Yeah,
All right.
definitely. And then, of course, we'll look at some neurological toxicity after that.
Yeah, exactly.
Yeah.
Yeah, new study I saw yesterday, 187 chemicals in the cord blood, and I've seen
Yeah.
others that had higher amounts. And
Yeah,
so
I've seen
people
like 287,
yeah,
300 and some. Mhm.
exactly, and it's
Yeah.
I'll have patients come in and I'll usually don't have that talk up front so much, but I will then get into toxic elements, and they said and my doctor said that can't be an issue. What am I exposed to? I live a good, clean life. Well, you came into the world with 2 to 300
Your
chemicals
bucket's
to
already
start with.
3/4 full.
Yeah,
Yeah.
exactly. Of course, I remember, my first functional medicine class was a weekend class in leaky gut, and that was in 1999, and I got dragged there by one of my friends, and I said, "I don't wanna do this," and she bribed me, and I went, and about an hour into it, my mind almost exploded. It was like, "Oh my god, this fits Chinese medicine absolutely
Oh,
perfectly." But then, of
yeah.
course, I came back and I'd see patients, and they clearly, in my estimation, had leaky gut, so I'd tell them, and they'd go to their doctor and say, "He said I have leaky gut." And the doctor'd say, Don't ever go see that lunatic again. You can't have a leaky gut. It's not even possible." All right. And of course, now they're the ones talking about it.
Right, right. Everybody has a leaky gut in this
Yeah.
society anymore.
I read one study, and this is a long time ago, 20 years, and they found that of the population they were testing, which is a pretty healthy population, they were finding severe leaky gut in about 10%. In regular Advil users, they were at 70%. And
Okay.
this is going way back, way back.
Yeah.
So, yeah.
Yeah. Well, if you have mood issues, if you're anxious, depressed, OCD, all those things, you know that there's a leaky gut component there too, because the neurotransmitters, 80% of your serotonin is in your gut. So
Mm.
you can't have anxiety and not have a leaky gut.
Right. Good point. One of a large group that I see are females with pretty severe, what has been called, what is MEC, well, now it's called MECFS, but there's a type that I see, and it's usually high functioning females,
Mm,
attorneys. I have half a dozen attorneys that have children, 2 to 3 children, and they are now suffering from severe fatigue. They can barely get off the couch. Right?
yeah.
Is that a type that you would see? And any comment about how you might treat it?
Yeah. So I would say, as we're talking about the five categories again, they probably fall into all five. They're probably low in serotonin, GABA, their endorphins, their catecholamines. Most of those high functioning women are on Vyvanse or another, Adderall type medication. And then their glucose regulation is horrific. So we would test all five of those categories with amino acids and then of course, assess their adrenal function and all of those things as well, which I'm sure you do as well. So yeah, I would say it's the whole picture there.
Yeah, which is why it's so difficult. You know, I've
Yes.
I've had
Mhm.
patients go to Stanford to their chronic fatigue clinic, and
Mm,
I'm supportive that they go because they get thousands of dollars worth of testing, done by Stanford.
mhm.
But generally, no matter what they find, they come back with pretty much the same drug regimen, and
Yeah.
they're told. I had one patient, one of the first people that went there, who was told, and she had 2 little kids. She'd been a very high functioning athletic trainer, and they told her, "Go to bed. Don't get out of bed for 2 years unless it's to go to the bathroom or to eat." That's what they told her, right? So,
That'll work really well.
yeah, right?
Yeah.
So,
Okay.
yeah, she was obviously then even more depressed,
I'm
right?
sure. How discouraging.
Yeah, and I've had several patients that have gone to pretty high level clinics, specialty clinics, and being told pretty much the same thing.
Yeah.
And I was clear with her that, yeah, it's not going to happen overnight. You're not going to get better overnight because this is a very deep seated problem. Obviously, your adrenals are taxed, your mitochondria, they're in a death
Yeah.
spiral kind of. And so it takes some time. So when you say test for amino acids, are you talking in person just with the sublingual? Or
Yeah, I'm
yeah,
talking about the sublingual testing. If you're a distance client, I'll send you a kit in the mail, and then
yeah.
we'll get on a Zoom call, and then we'll test them like you and I are talking right now.
Huh? Wow, that's fabulous. And so in high functioning women, then that maybe don't have chronic fatigue to that point, is there any way like you talked about working with moms. In our
Uh-huh.
culture, moms are gonna be stressed. You know,
Yes.
when I was a kid, I played sports all year round. My mom never went to a game, never drove me to a game. It was just a different time. And now I'll see families where, the parents are constantly busy on the weekends, driving
Mhm.
one kid to soccer, one kid to volleyball, one kid, and it's just nerve wracking.
It
So, for
is.
that high functioning female, any suggestions other than slow down?
Well, protein. You have to fuel your body. So if you're not eating well, you're not going to feel well, of course. So good protein, good fats, get in some fruits and veggies as you can. But if nothing else, take a full spectrum amino acid supplement that is going to
Mm,
feed your body, feed your brain in a way that nothing else can. I like Total Amino Solutions by Janessa because it's all of the amino acids. Says, I don't think we're just deficient in those 8 or 9 that they, tell us are essential. I think we're deficient in all of them.
mm. Would you be willing to spell Janessa?
Yeah, here, I actually have it on my desk, but it's Genesa. And if you're, watching, this is a picture of it.
Cool.
Yeah.
Excellent. Thank you. And if someone was going to just take one simple thing, one simple shift to support their brain health, do you have any recommendation?
I would say make sure you're getting enough protein.
Okay. That's that. I've become a protein fanatic lately.
Yeah, and I'm not talking like 200 milligrams a day. I just eat.
Yeah.
Just,
No, I agree.
4
I
ounces at each meal. Just start there.
right. I weigh about 245 pounds. And so if I look at the dietary recommendations or whatever recommendations for protein intake, I couldn't eat that much. So
Right.
I aim for a little bit lower, but there's so many supplements now, and I try to get everything or as much as I can from food, but I get a kefir with 30 grams of protein and I get a
Mhm.
cacao drink with 30 grams of protein and I drink those at the office. So then I'm pretty well on my way. So if I eat a decent meal in the
Right.
afternoon, I'm, going to be getting over 100 grams at least. And boy, I feel 100% better when I do
Oh,
that.
yeah. Yeah, we're expecting we can't drive your car if it's on empty. It's the same
Right.
thing like your body. You can't drive your body doing all the things that we do in our current society when it's running on empty with no protein, no healthy fats, and no hydration or minerals. One of the other things I would say is get yourself some, Redmond sea salt. I keep this on my desk all day long. I
Well,
lick my finger, I stick my finger in it, put it
yeah.
on my tongue, and I move on with my day. You need those minerals.
Yeah. Catherine and I have a book called The Sweet Spot. And so it's looking at one book is looking at the complete blood count, and the other one's looking at a metabolic panel. And we go through and talk about kind of the boilerplate. But then I went through, and Catherine did that. I went through and researched I probably read close to 1,000 studies and
Wow.
looked for huge studies that were quite clear about what the best values were to stay in that sweet spot, with the
Mhm.
U-shaped curve. And you want to be right down here to have the lowest mortality risk. And in one of those books, we have an entire section on salt, right? Because
Mhm.
it's a mineral in there. And I'd give several case studies of patients that just had to increase their salt intake, because we are so salt phobic and, with good reason, many people eat way too much salt. But
Well, the
I
wrong
had
kind
one,
of salt.
yeah, right.
Yeah.
I had a patient come in, type A, just driven. I mean, she was just, the way she fired questions at me. And she'd seen 4 or 5 doctors, a naturopath, and she said, every day while I'm driving my daughter to school, I have to actually pull the car over and I can't function for about 20 minutes. And I
Wow.
said, Okay, well, what do you do before you drive your daughter to school? She said, I get on my Peloton. And I said, do you have a nice, easy ride? She goes, no, I'm a fanatic. I go 60 minutes flat out. I said, do you perspire much? She said, I put towels all around the Peloton, right? I said, okay, I've got a very expensive fix for you. I want you to do half a teaspoon of salt before you get on to ride and a half a teaspoon afterwards. And I want you to take electrolytes later in the day. I saw her once more and she was fine, right? That
Right?
was it. Yeah. Again,
Yeah.
don't try this at home because you might be one of the people that are salt sensitive, but I find very little hypernatremia, elevated sodium levels. I find a
Very
lot
little.
of low. Yeah.
Yeah.
So,
I
so
had
I'm,
a client once and we did the amino acid therapy and she got about, I would say 70% better with amino acid therapy, but she still had the PMDD. So, that premenstrual,
wow.
very bad
Yeah.
dysfunction. And we started increasing her salt. She got to like between 4 and 5 teaspoons of salt, like right before her period. And it was a game changer. Game changer. Now, I wouldn't recommend, most people don't need that much salt, but for her body and her situation, she was so depleted and her cycle depleted her of minerals so profoundly that until we put that much salt in her, she didn't feel 100%. It was amazing to watch. And it was just salt, just, Redmond sea salt.
Wow. And one of the things that's really resonating as I listen to you is how individually you look at people. You know,
Of
it's
course.
not one size fits all. And you say, of course, and I would say, of course, but, in the medical world, there's a lot of one size fits all treatments. So,
Right.
yeah.
Yeah.
And what's the best way to get a hold of you?
You can find me on all social media channels at Take Back My Brain. That's my podcast as well. I'm very active on Instagram, so if you want to message me on there, I'd be happy to chat with you.
Okay. That's delightful. Any, that's taken me through all of my questions, I think. Anything you want to add about anything?
Oh gosh, amino acid therapy is just so fun. I Every time I do a trialing with somebody, it's like Christmas to me. And at the end, they're like, I cannot believe that this happened. Like, I can't believe all these things happen this fast. I'm like, yeah, we're just feeding your brain. Amino
Yeah.
acids are just little pieces of protein because amino acids make, up a protein. And it's just that simple. You just have to get the right combination and the right dosing. And so I love what I do. I've been doing this for decades and I wouldn't change it.
That's awesome. So, anybody that's interested, check Laurie out. Again, Laurie Hammer. She's a functional nutritional therapist and the founder of Take Back My Brain. So, Laurie, I think that's about it for today. And I can't tell you how much I appreciate this and how much value it's going to get for the people that listen to it.
Well, thank you so much. I appreciate being on here, John. Have a great day.
Okay. Thanks, Laurie. Bye bye. Thank you for joining me on The Balancing Point. If you enjoyed today's episode, please follow the show, share it with a friend, and leave a review. Feeling out of balance? Most approaches just manage symptoms. Here, we get to the root. So, real healing, real clarity, and balance can begin. Visit alamedaacupuncture.com. That's alamedaacupuncture.com to learn more, explore our supplements, or book a call. We'd love to hear from you.